Good afternoon, and thank you for attending another episode of the BTC webinar series. My name is Simone, and I'll be your moderator today. For those of you who are new to our webinar series, we host webinars each month, partnering with experts in the industry. In each episode, we strive to cover various topics on clinical research, including but not limited to operations and optimization, patient recruitment and retention, financial services, technology, and more. We invite and encourage experts from all realms of the healthcare industry to present in our webinar series to help promote learning, idea exchange, and progress. Our mission is to spread inspiration for clinical professionals by clinical professionals. We'd really like to hear from you and would like to include your voice in the conversation. So ask questions, share comments, even challenge your ideas. Use the question and answer panel on the right side of your GoToWebinar sidebar to share at any time during the webinar. Today's presentation is called How to Land More Studies in Your Pipeline. And I'd like to introduce today's presenter, Casey Brescia. Casey is the Director of Site Relations and has been with BTC Network for about 3 years. She started her career in clinical research as a study coordinator at Massachusetts General Hospital in 2009 and has been working in the research field since. With BTC Network, she oversees the business development team and works closely with research sites, sponsors, and CROs in several capacities. The BTC Business Development Team dedicates their efforts towards increasing research sites, clinical trial pipelines, and profitability, while also streamlining the site selection process for sponsors and CROs. So once again, if you have any questions during the presentation, please submit your questions at any time in the box in the right side panel of your screen. There will be about 10 to 15 minutes at the end for a question and answer session. I will be asking questions out loud at that time. Any questions not addressed may be answered in a follow-up blog post or answered directly by email. Without further ado, I'd like to turn it over to Casey to begin.
Hey everyone, and thank you so much for joining today. Today we're going to talk about probably the most important piece of running a successful research program, and that's just successfully landing your self-studies to generate that cash flow. Now when it comes to landing more studies and maintaining a healthy pipeline of studies at your site, there's really 3 main areas of focus that come into play. And we all know that with the ever-changing trends that occur in clinical research, the amount of studies your site sees each quarter can definitely fluctuate drastically. Because of that, it's more important than ever to have a site that can adapt in such a competitive industry in order to keep your pipeline lined up for success. So as I mentioned, we'll dive into 3 main areas and discuss some key strategies to stay ahead of the game and set your site and yourself up for success. So I'm going to go into detail on finding studies and outreach approaches. So if there's a slowdown in your primary area, what can you do as a research site? Who are the most appropriate people to connect with for those trial opportunities? Are you reaching out to the right people? And when reaching out, are you not getting a response? Maybe all you need to do here is just switch up your approach. We'll talk about the importance of study pipeline management. So if there's anything I've learned since being in this industry, it's that organization is of the utmost importance if you want to be successful. There are so many moving parts with each separate study opportunity, so having some sort of pipeline management or tracking system in place is definitely crucial. Otherwise, important items can be overlooked, missed, or just not attended to in time, which is never a good look to a sponsor or CRO, of course. And lastly, we'll just talk about some approaches and steps you can take to make your site stand out from the many. We'll cover the importance of having a strong online presence and why taking your time and giving that touch of personalization with those feasibility questionnaires really goes a long way for your site. So first, we're going to talk about ebbs and flows, seen in the research industry, and what sites can do to maximize themselves during slower times. The clinical research industry sees ebbs and flows in the number of trials being conducted within specific therapeutic areas and indications. So variations on the number of trials being conducted definitely has a direct impact on research sites. Fewer study opportunities in a site's primary therapeutic area is going to lead to increased competition, of course, for each of those opportunities. And as a result, the increased competition and fewer opportunities can lead to a decrease in future revenues. So what can a research site do when they find themselves in this situation? How can a research site become adaptive in this environment? Now, this is where therapeutic forecasting can assist sites in anticipating these potential slowdowns and prevent loss of potential revenues. So adaptability is not only beneficial, it really is crucial to becoming a successful site. And it's especially true for sites that are primarily focused in one or two therapeutic areas. Therapeutic forecasting is a powerful tool for gaining those insights on how to adapt in the ever-changing clinical research environment. So what exactly, do I mean by therapeutic forecasting? So therapeutic forecasting is the use of data sources to analyze and predict trends in research. There's definitely a variety of sources through which insights on potential momentum can be gained, so I'll go over a few of those key sources. The first being clinicaltrials.gov, and I know we're all very familiar with this source. So at the most fundamental level, clinicaltrials.gov allows you to perform searches and returns results of studies that meet the search criteria, of course. It also has a variety of basic and advanced search functions that allow you to filter studies through a variety of parameters, including indication, location, phase, and study status even. There's also a trends, charts, and maps section that provides a broad overview of all registered studies by location, type, and number. And just overall, clinicaltrials.gov is a great tool for sites trying to gauge the current study environment. Its adaptability allows for users to search in both a highly targeted or a more general way. Sponsor pipelines, also another key source. They provide one of the most readily available and powerful sources of data. So pipelines, they provide insights into a sponsor's R&D efforts and their trials, as well as oftentimes preclinical assets. So essentially, they serve as an outline of the areas and indications a sponsor is conducting or planning to conduct research in. It also serves as a means to track progress that each potential drug has made so far. There are also a variety of organizations who routinely put out reports on various facets of the clinical research industry. So some such organizations include CenterWatch, CISCRP, or many CROs as well who do this. You can also kind of stay in the know through the use of daily press releases and articles such as Business Wire, Biospace, Fierce Pharma, to name a few. So by abstracting and examining the data through all of these sources, your site will be able to grasp an understanding of the most common therapeutic areas in which we can expect upcoming trials, as well as just general industry trends for 2018 and beyond as well. So now that we've kind of just gone through what therapeutic forecasting is, I will briefly touch on how sites can use forecasting to set themselves up for success and work towards keeping a constant flow of studies in their pipeline during those slower times in their primary areas. One approach to consider is expanding into new therapeutic areas and indications. Sites can actually proactively set themselves up for success by doing this. Now, this goes hand in hand with what we discussed earlier on why adaptability is crucial to becoming a successful research site. Of course, this might mean that you're going to need additional staff, PIs, equipment to ensure you are capable of conducting studies in a new therapeutic area. For example, just to dive into it a bit, if your site is interested in breaking into Alzheimer's disease, there are a variety of rating scales used in screening and subsequent visits that sites must be aware of beforehand. So because of this, interested sites need to consider bringing on experienced raters to ensure they're capable of conducting the studies. Osteoarthritis is another great example as well. We've definitely seen a rise in trials with study drug being administered via intra-articular injection. So sites are going to need personnel with experience administering these injections. Even if that experience is outside of clinical trials, that's perfectly okay. For sites interested in pulmonary indications as the last example, it's important for sites to understand, those additional procedures associated with these trials, such as pulmonary function tests, including spirometry. This could, again, involve both additional equipment and additional staff. And, it also may mean being okay with taking on those less competitive opportunities to build up experience. Sometimes getting your foot in the door is going to mean taking on the phase 4s or the observational or registry studies, which are typical lower budget studies, but they do help build up your PI/CDs and build up that experience. While they may not be the most appealing studies for sites to take on, they're a great way to build up the experience, which in turn helps sites become more attractive to sponsors during evaluations on those more competitive study opportunities down the road. So some PI specialties actually lend themselves to breaking into other therapeutic areas and indications. So even if you don't practice in a specific vein of research, you may already have the population available for a different study. Highlighting this to sponsors will help you ease into a new area that you may not have any prior experience in. This is great news for sites that may not yet have those financial resources needed to bring on additional PIs or other staff. When a study team is evaluating 2 PIs without trial experience in a specific indication, the PI with the study design and procedures familiarity and the PI who has access to the patient population already is going to be much more attractive in terms of study consideration for that particular opportunity. Some examples being psychiatry and pain or addiction. So a few examples are chronic pain, that would be 3 months of pain or longer, and substance abuse. So chronic pain sufferers often report an inability to engage in occupational, social, and recreational activities. So this inability to engage in these activities may contribute to increased isolation, feelings of worthlessness, and depressed mood. Research in this area indicates that approximately 27% of patients or so with pain in primary care clinics meet the criteria for major depression. And then that same logic also holds true for addiction. Urology and women's health is another example. There are a variety of women's health indications that urologists see and treat throughout their practices. Pulmonology and sleep medicine. So this could include an indication example such as obstructive sleep apnea. It has also been shown that people with COPD and those with asthma have worse sleep quality and more sleep-related problems when compared with people who have other chronic health problems. So also, if your site is active in the community, you should already have connection to local businesses and other sources that refer patients to your site. So by making it known that your recruitment areas are shifting, your referral sources may already have access to patients in your community. So now that we know how to interpret what's trending in the industry, how do we increase our chances of actually landing these studies? So to start, who is doing the research? So this goes back to what we talked about previously regarding therapeutic forecasting. There are several readily available resources at your fingertips that will help you stay up to speed with who's who and what's trending in the industry. So who do you contact if you want to be involved? Of course, my first suggestion would be to join a site network. So an experienced business development team can actually handle all of that outreach for you and are fully dedicated to maximizing your pipeline. However, when you're doing this outreach independently, you can utilize those same resources we just touched on to locate appropriate people to reach out to. There's often contacts listed via those sources. In addition, there are also available subscription-based online database sources you can sign up for in order to locate appropriate contacts as well. Now, when looking for contacts, you want to keep an eye out for related job titles, such as anything involving site identification or project manager, to name a few. People with these or similar titles are commonly key players and decision makers when it comes to site selection. And of course, this is going to vary across companies because every company is so different. For example, you're more likely to get a response from reaching out to a CEO or a director of clinical operations or someone higher up at a smaller therapeutically aligned company over a larger global company. We are also going to talk about some outreach methods and follow-up strategies. So how do you make a lasting impression and work towards building those important relationships? Just like with any relationship, good impressions, especially first impressions, are key here. You don't want to get lost in the shuffle, especially given how competitive the industry continues to grow each year. There are some specific approaches you can take to ensure that the sponsor remembers you and always comes back to you first for new projects down the road. So some general tips to go by: we always want to be calling first. Always give it at least a day or two before trying again after that first try. You don't want to come across as too pushy right off the bat. Getting someone on the phone is key in building a good relationship. You want to be persistent but also polite. Some polite pestering will help you stay relevant and in the loop. If they don't pick up after the second call, now would be an appropriate time to leave a short voicemail and follow-up email mentioning your call. At this point, you would make note to follow up again in about a week or so. The frequency of your follow-ups, though, of course, from here moving forward, would be dependent on what you're reaching out for. For example, if you're reaching out for a study that you know is active in feasibility right now, you would follow up more frequently, so I would say weekly, than if it was just general outreach, where you could push that outreach out a little further. You always want to try multiple contacts and learn the organizational structure of the companies you're reaching out to. So just educate yourself on how the company is structured in order to give yourself a general idea of who would be best to reach out to. Every company is different, so knowing the organizational structure will help you in the long run. Don't make the mistake of only sticking to 1 to 2 contacts if you're not having any luck, and this especially applies to the larger companies. You always want to locate other potentially relevant contacts and reach out to more, instead of always circling back to those same few people. The more channels you try, the higher your chances of eventually connecting with someone who will put you in touch with the right person. You also want to, of course, know the sponsors and CROs. So personalize your emails. Be specific in your outreach, highlight your site's capabilities and experience. If you're reaching out to a sponsor regarding a specific compound or indication, providing details on your interests and qualifications will definitely go a long way towards being considered for that trial. For example, if there's been new developments for a particular drug and you want to get in for that next phase, you could mention your excitement regarding that specific drug in your outreach. Sponsors love to see when people actually take the time to educate themselves and are passionate about what it is they're doing at their company. To showcase experience, you could provide prior enrollment metrics right off the bat in the email to show them how well you've performed on similar studies previously. Historical study metrics are beneficial to track during the sell to a sponsor or CRO in order to justify your site's experience. So when do we want to follow up with these contacts? So for CROs, timelines and study pipelines can change frequently, so it's good to check in on a pretty consistent basis. I would follow up with your contacts every 3 weeks or so, but for sponsors, timelines can often get stretched. So check in once every 1 to 2 months. If they don't have anything coming down the pipeline for a while even, checking in every month or two, it serves as a reminder to sponsors that you're still there, you're still interested, and then once an opportunity does come down the pipeline, you will be at the top of their list. And of course, these timelines are not set in stone, but just as some general guidelines to be mindful of. You always want to tailor your outreach around the responses you do receive. For example, if a certain company tells you to check back with them at a specific time point, you would, of course, set a reminder for yourself to follow up again around that appropriate time. It is also extremely important to stay organized and on top of your follow-up so nothing falls through the cracks, which can definitely lead to missed opportunities. You want to track your outreach and what you're doing in real time. Set recurring reminders for yourself via an internal tracking system, and this can be whatever works for you. Some examples could be using your email Outlook and scheduling reminders for follow-up, or there are a few other online platforms that are utilized for tracking outreach and communication, of which we utilize here at BTC. And lastly, there are annual conferences that are specific to research happening in certain areas every year. So some therapeutically aligned conference examples could be the World Vaccine Congress and the CNS Summit Conference as well. And at these conferences, you'll create connections and possibly meet that person that will help you land studies in real time and down the road. So next, we're just going to go into personalizing your emails in a little bit more detail. So we do not want to overuse templates. This holds true especially for instances when you're following up with the same contact more than once. In my experience, the more personalized the email, the more likely of a response. Receiving a lengthy template type email over and over is more than often going to result in silence for you. So how can we personalize our emails and stay away from sounding like that sales type person? So you want to talk about your interest in the study or company. This is something that I already mentioned, but the importance of your true interest in the research they're doing is huge and will make you stand out from the others. Is there a specific compound you're reaching out about? If you read something about a compound or upcoming next phase in a recent article, mention that article in your outreach. Talk about your excitement about that specific compound and why you're so excited about it. Sponsors love to see that kind of stuff. You also want to briefly mention your site's capabilities as well, and I know we touched on this previously, but presenting historical enrollment metrics or details on your site's infrastructure will give you the leg up. Seeing this information up front can definitely make your site more appealing to a sponsor, and you're actually also just beating other sites to the punch by presenting enrollment data well before the feasibility process if it's a study that hasn't entered that stage yet. So what makes your site stand out from the crowd? In addition to the above, one way to do this is to talk about maybe how you would recruit for that particular study. Some questions to ask yourself could be, how many patients do I have access to for this? What are my resources for these patients? Does the PI have a large active practice? Are you affiliated with any nearby hospitals or specialty centers that would benefit for this particular opportunity? Do you work with a network of referring physicians? Are you active in the community? Adding a little something extra about why you're a top choice goes a long way and gives it a personalized touch. And of course, last but definitely not least, shorter is always better. In my experience, you're much more likely to get a response when you keep your email short and sweet and to the point. Steer away from templates or writing a novel. You can always elaborate on further details later on or over the phone after you make that first connection. So next, I'm going to show you an example of a personalized email. So this is a fake email example I put together of myself reaching out for a fake hypertension trial I know a fake local company is working on. And as you can see, I did keep it short and sweet, while at the same time included some personalized details on my PI's experience with hypertension and made sure they were aware that we're also a fellow Massachusetts-based company, giving it a little personal touch in an effort to help me stand out from the competition, given that hypertension is such a, a competitive indication. And as you can see here, I tried to make it so that I was showing that I was pretty excited about this upcoming program, expressing that excitement about the research a company is doing will only work to your benefit because they like knowing, like I said, that you've taken the time to really educate yourself on their work and what it is they're doing. So I know this may be a little redundant, but I cannot stress enough how important it is to stay away from these below habits. I know the outreach process can definitely be frustrating at times, but being too sales-like and too aggressive can definitely push people away rather than draw them in. So overcalling is one that you definitely want to avoid. You want to be persistent, of course, but following up too much can turn people off. So just be mindful in your follow-up. If you haven't received a response from somebody, maybe after the 5th email or so, I would scale back a bit on that contact and try somebody new if that's a possibility. Again, overuse of templates. Personalize and take your time putting together a solid, attractive email and steer away from templates. If you don't already do this, start today. Once you start, you'll see that the response levels are definitely going to increase over time. Long emails or voicemails you want to stay away from. The shorter emails and voicemails are easier to digest and you're more likely to get a response. And just with the phone calls, don't get right to business. You want to build a relationship. So try to get a feel for what they enjoy or they're interested in. You can start by maybe talking about the weather or sports or even weekend hobbies if you get to that point. Try to get a feel for their personality during those first few calls. In my experience, people will definitely be more open with you and want to work with you more if they feel personally connected to you and it's not just all about the work. So to tie it all together, as you build strong relationships with these companies, you'll start to see that the studies will come to you directly, in time due to the already established relationship. This, of course, is not going to happen overnight, and everything good comes in time and with patience, persistence and effort on your part. But by combining all of these above outreach tactics and setting up an effective follow-up system for yourself, it's going to pay off down the road, and sponsors will start coming to you as they remember you. And once you break through to a new company and finally get that first opportunity to enroll on a study, it goes without saying that performance on your first study with a company is crucial and key. If you perform well, they're more likely to want to come back to you for future studies down the road, even for those, more highly competitive ones that are harder to get considered for. So once you land the studies, it's definitely important to stay organized and have a structured pipeline management system in order to stay on top of everything happening and to be successful with those studies. So what exactly do I mean by study pipeline management? And what can you do at your site to keep organized and make sure nothing falls through the cracks for you? So you want to develop a tracking system to keep yourself organized. Having a study pipeline tracking platform to keep track of all of your study opportunities, especially those that are pending in the feasibility stage, will help you stay on top of your study submissions and follow-up during that site identification process. It's definitely easy to let things fall through the cracks when there's so many moving parts, several things happening at once in different stages and at different paces. So staying on top of your submissions and sponsor communications will only benefit you and bring in more study awards in the long run. As we discussed earlier, there are a few different subscription-based online systems that can be utilized for these tracking purposes. Here at BCC, we actually use an online platform where we're able to track all of the site's trials and categorize them by current status, as well as track all of our outreach and ongoing follow-up with sponsors and CROs. So via this tracking system, by keeping these trial notes updated in real time, throughout our follow-up processes, we're able to maximize our site's pipelines and ensure they are fully considered for every opportunity that they're submitted for. So the categories you can include on these pipeline tracking systems could be, pending, delayed, awarded, and declined, to name a few. So you're able to just keep track of every opportunity that's presented to your site, regardless of whether you decide to move forward with that study or not at that time. I feel it's important to keep track of everything presented to you by a sponsor, because there could always be an opportunity to revisit a study or company down the road. And studies in the pending category would, of course, be those studies that are in the feasibility process that you're under consideration for but not yet awarded to you. So next, I'm actually going to show you an example of what an organized study pipeline can look like, involving all of these categories and key pieces of information. So I apologize if this text is too small and you can't see it. I'm more than happy to send everyone an example after the webinar, but if you can, as you can see on the example here, so the status of each study is outlined on the left-hand column, and I have it separated by pending studies. So those are the studies in feasibility. Delayed, these studies are delayed with the sponsor or CRO pending timelines, and then awarded is the study awarded to the site. And each study also has a detailed note on the site's current status all the way to the right-hand side. And dates are inputted for tracking when important documents were received and submitted. So I have a date for when the CDA was received at the site, when it was returned to the sponsor, feasibility, and when the feasibility was returned to the sponsor. And I also have a section for, of course, when those pre-selection visits are scheduled at your site, so you can easily track those as well. By having your studies all in one place and by keeping a pipeline like this updated in real time, you are less likely to fall behind in the feasibility process and miss those important deadlines. This also serves as a helpful forecasting tool, so you can easily track when studies are expected to start with enrollment. Having a layout of when each study is projected to start will help you, strategically decide which studies are the best fit for your site given those timelines. And in my experience, CROs and sponsors are definitely more likely to move forward with sites that can turn around startup documents quickly over sites that take a longer time or multiple weeks to return CDAs and important feasibility documents. Keeping track of your document submissions will ensure that everything's submitted in a timely manner, and it's only going to benefit you, and in turn, increase your chances of being awarded those opportunities. So now that we know how to find the studies, reach out to sponsors in the most effective ways, and develop an organized tracking system to maintain a structured pipeline, how is it that you stay ahead of the competition in such a highly competitive industry? So during slower times, it's definitely important to maintain that competitive edge. As we discussed earlier, the studies are becoming more and more competitive, especially for those sites who only conduct studies in a certain specific area. So to maintain a competitive edge, you need to take specific action in order to make your site stand out, especially if your specific area is a competitive one. And I know we went into detail on this previously as well, but it's important to try your best to establish a presence in new therapeutic areas as well. So in addition to establishing a presence in new areas, what other steps can you take to maintain that competitive edge? So first, you could work to increase your referral network. Local physicians are definitely a powerful powerful source for new potential subjects. Hosting lunch and learn in your community is a great way to not only get your research site's name out into the community, but also just meet and network with new physicians. You could send out email invitations to physicians, spread the word in local businesses, or send direct mailers to to encourage the physicians to attend your lunch and learn. Now, during these lunch and learns, be sure to focus on clinical research as a whole and how they can benefit from joining your particular site. Having an online presence, especially nowadays, is also a huge one. So several sponsors and CROs are checking to see if sites have websites and an online presence. I've personally seen sites actually turned away from studies due to not having a working website and no presence online. So in today's world, having that is not only beneficial, but kind of an expectation if you want your site to be taken seriously in such a competitive industry. And not only is it important to have a website in general, but having it be mobile friendly is a huge one as well. As you can imagine, mobile friendly websites have a much higher visibility in search results. And also just listing your site's capabilities and staff experience on your website. Having this detailed information allows the study teams from the sponsors to get a quick overview of a site, what additional information is needed to make those final decisions on site selection or for a potential study fit. You could also use your online presence as a powerful recruitment tool. There are a variety of ways that sites can use their website and social media advertising to kind of streamline patient recruitment and also add new potential study subjects to their database. For example, social media ads for a specific study can direct to a site's landing page and a pre-screening form to capture potential study information. So this pre-screening form also serves as a way to cut down on your screen fail rate, which is a definite win as well for your site. So putting your best foot forward on feasibilities is another way of making your site more marketable as well. Putting your best foot forward in everything you do is important, especially in such a competitive industry. So I'm going to dive into some tips and tricks to best increase your chances of landing the studies that you really want. When completing these feasibilities, think of it kind of like this. So a feasibility is just like a job or college application. So the end goal of that application is to land that interview, or in this case, land that pre-selection visit to give you an opportunity to, finally meet in person. But in order to get to that point, you need to sell yourself on paper first. So feasibility questionnaires. Of course, for sites, you're showcasing your fit for a particular opportunity. And when filling out a feasibility questionnaire, your goal should be to provide as much information as possible, showcasing why they would be a great fit for the study. And of course, these questionnaires are the tools that CROs and sponsors are using to evaluate your site for a study. As we all know, this is often study teams' first step in reviewing your site's detailed information. So you want to sell yourself the best that you can here. Some best practices to take away from this. First being, do not leave any questions blank or NA. I cannot stress this enough. On many competitive study opportunities, sites who turn in incomplete questionnaires are not going to be considered over those sites who take more time with their questionnaires. If you're serious about being considered for the study, don't rush and take your time with the questionnaire to ensure that nothing is skipped over. You always want to provide as much detail as possible. Now, this goes without saying, but the more information, the better. This is your opportunity to sell yourself. Every question is an opportunity for you to provide as much detail as you possibly can to showcase why you are the best fit for the study. Remember that your site is being compared to hundreds of others for those more competitive trials. So make your feasibility stand out from the crowd, which brings me to the comment section. This is a section you always want to use when it's available. Many feasibilities have a comment section. This area serves as another way that sites can stand out from the competition. You can provide any information, that was not fully captured by the questionnaire, and even further explain your reasons for interest in this particular study opportunity. When looking over a feasibility, the study teams As a sponsor, they need to gauge if a site would be able to enroll the study well, of course. So this is why it's crucial sites put forward as much information on their patient population as possible. And when completing this section, you always want to consider all of your resources for potential patients and not just your research database alone. For example, does your PI have a private practice you could pull patients from? Are there any relationships with potential referring local physicians? Considering past experiences at your site, how many potential patients do you estimate you could bring in using effective advertising methods? You want to keep in mind that these are just estimates, so it's okay if these numbers are not exactly what your database is reflecting at the time you fill out the feasibility questionnaire. You can always dive into the details once that PSV is scheduled, and at that point, you're better able to sell yourself in person anyways. Enrollment estimates is another key component, study teams are evaluating to make decisions on which potential sites to move forward with as well. You want to be aggressive when providing these estimates, but keep in mind to be realistic at the same time. Providing outrageous enrollment projections can be just as much a red flag as extremely low numbers put on the feasibility. Take a look at the synopsis and, do the math there. How many subjects is the study looking to enroll overall? How many sites are they seeking? This information can typically be readily available on the synopsis. If it's not, you could always consider, the phase of the study. A phase 3 trial is going to need way more patients than a phase 1 or even 2. Just use your best judgment when providing these numbers on the feasibility questionnaire. Lastly, just make sure you can back up the information you're providing. You, of course, want to consider all of your resources when providing these estimates, but just be sure that they're, existing realistic resources that would be able to feed you patients for that particular opportunity you're going for. So, and just pulling everything together that we discussed, there are a number of steps you can take to develop and maintain a healthy pipeline of studies at your site. First, there is readily available information that we previously went over, through a variety of sources that can assist in forecasting and setting your site up for success. I also cannot stress enough that, reasonable persistence and personalization is key when establishing relationships with sponsors and CROs and really landing those studies that you want. Having an organized system for tracking your study pipeline is necessary to stay on top of all of the moving pieces with your studies and just to ensure that nothing is missed or overlooked. Having a categorized tracking system will only benefit your site and really just maximize your site's full potential. And like I mentioned, this can also serve as a helpful forecasting tool so you can track when studies are expected to start and make the best decisions for your site. And lastly, in order to maintain that competitive edge, having a strong online presence and putting the time and effort forth to make for a strong feasibility will really help you stand out from the competition. On those feasibilities, you never want to leave any sections blank and always provide as much detail as you possibly can. If there is no comment section, like I discussed previously, you could always also just send a quick follow-up email to the person who sent you that feasibility and provide your additional details and further interest that way as well. So just implementing these tips and strategies will assist your site in developing and maintaining a healthy pipeline for 2018 and beyond. So that is it, and thank you.
All right. Thank you, Casey, for your very informative presentation. We do have time for some questions. We did get one question, and I do think we did review all the questions that came in before the webinar. I think Casey did a really great job covering those. But the first question we have is, on feasibility questionnaires, the new trend is to ask about standard fees or costs that are expected by your site. Do you complete this area of the questionnaire with all of your fees? Our company is afraid that if we do, it will work against us. Do you have any feedback on that, Casey?
Yeah, that's a great question, but anything financial, in order to give you the best response, I can definitely bring that question back to our experienced finance team, and I'll be able to follow up with you after the webinar.
Yeah, perfect. We did get another question. This is probably the same person, but what do you think about using a broker?
Yeah, definitely. I absolutely think it's beneficial. Having an experienced and dedicated team dedicated to those outreach efforts for your site and really maximizing your site will only help you. And, I know here at BTC, our business model and the services that we provide are extremely personalized, and we really, take the time to get to know your site in order to push your site for as many clinical trial opportunities as possible. So the sites in our network, they average a good 2 to 3 study awards per quarter, depending on the size of the site. So I absolutely think it's beneficial to be a part of site networks such as ourselves.
Okay, perfect. And it looks like we have a few questions about slides. We will be sending out a copy of the recording to everyone, and if you would like a copy of the slides, you can email me at Simone, SIMONNE, @btcsites.com, and I can go ahead and send them to you directly. But if those are all the questions that we have today, yeah, please keep an eye out for the follow-up email. It'll alert you for the on-demand status, and we can review any material missed or simply go over them again. I do have a pull-up if you'd like Casey to follow up with you directly about our network of sites. She'd be happy to do that as well. But on behalf of BTC Network, we'd like to thank you for joining us today and taking the time to do our presentation. Have a great day.